I'm so thrilled that RFKJ got in there and is going to be looking into things like this. I mean, already, yesterday there was an EO on transparency on drug costs. Already he's taking a look at interesting things. And he stopped, what was the thing that he stopped yesterday? He stopped something. It was a testing program that was going on for the oral COVID vaccine. He was like, we're not stopping it forever, but we're pausing that. I'm not sure that's the best use of our resources. So already he's in there questioning, you might say, questioning. So as somebody who knows him and has worked closely with him, what do you think are going to be the top items we'll see over, let's say, the first 100 days or so?
Well, listen, I think, and if everybody can look this up, because I was, there's a brilliant executive order from the president, obviously with Robert Kennedy Jr.'s input, on the MAHA plan. And Megyn, it's absolutely extraordinary. It's so comprehensive. They've covered essentially everything. So they're going to look at, all of the existing data when it comes to nutrition, when it comes to environmental influences on health. They've set up a commission. This was what heartened me the most, to look at how different sectors of our lives, whether it's housing, education, income, how that impacts on your health. And why that's really important, Megyn. This is a conversation that needs to be had in America and across the world. We need to go back to square one to understand what are the building blocks of a healthy society? What does it mean to be healthy? And one of the things that hasn't been discussed enough or ignored, if you like, is that, if you look at, I'll give you some figures here. Okay, in the United States and even in the UK, it's not dissimilar. The gap in life expectancy between the richest and poorest is about 10 years on average, right? It's huge, okay? Healthy life expectancy difference is about 20 years. When you look at the data, about 80% of that difference can be explained by what we call the social determinants of health, or the wider determinants of what it means to be healthy. So and this basically means having, an income that allows you to lead a healthy life, good quality housing. A lot of people are suffering in the United States because, they may be certainly through the winter, they don't have adequate heating, access to education. If you are in a job, Megyn, that is high demand, low control, low pay, you're on the minimum wage, which I understand in the US, certainly pre-pandemic, was about $7.25, then that can be more damaging to health. The stress associated with being in those sorts of conditions, Megyn, can be more damaging to health than being unemployed. Okay. Wow. And what's the mechanism? The underlying mechanism is severe chronic stress. So if you have chronic stress over your lifespan, if you're, for example, brought up in a family, if you're a child that is, in a deprived family, or you're a victim of severe psychological abuse or emotional abuse, that starts to already have an effect on the disease process that will cut your life short later down the line. These are the conversations we need to start having. So that's why what's really fascinating is it's about health through all sectors. So we need to look at the Department of Education, housing, et cetera, and say those departments, those agencies, if you like, they need to be having health at the forefront. There was something I was reading really interestingly recently, is that Thomas Jefferson in 1809, in an address to Republicans in Washington, said, the care of health and human happiness, and not its destruction, is the first and most important object of good government. That's Thomas Jefferson, right? For me, it's not about big government or small government. It's about good government, because ultimately the politicians have the control over laws to ensure that we create conditions so that everybody, Megyn, who's going to disagree with that, has the best opportunity to lead the best life they can in terms of their health. And this isn't just about people who are not well off. During the pandemic, Megyn, Boris Johnson, our prime minister, I commented on this. He got hospitalized with COVID, and I said it's likely because of his weight. I said it in a compassionate way. He was after he came out. I didn't say it when he was in hospital. And, that became a big story because he was, and he admitted it, obese. And this is a guy who's got agency. He's got wealth. Right? And this tells us that all of us really are in this because we're affected by this ultra-processed food environment. We've been misled about information about cholesterol, about what's a healthy diet. So I think all of this is going to be uncovered under Trump's administration, under the leadership, certainly on health, of Robert Kennedy Jr.
That's so encouraging. Just even back when I was in school, I can't even remember whether it was high school or college right now, but we learned about a study that had been done on two groups of monkeys. And it was that, I think it was monkeys. It might have been a different primate, but it was that there were two different cages of them, and they like a dominant monkey. Like the order works best when there's one dominant. And what they did was they put two dominant in one cage and just the one dominant in the second cage. And the monkeys got exactly the same food, exactly the same lifestyle. Nothing else was different other than the one cage of monkeys was very stressed out and the other wasn't. And then many years later, when they died of totally natural causes, they were dissected and they looked at their arteries, and the arteries of the monkeys that had been in the stressed out cage were completely, they were clogged. They were not the picture of health versus the other monkeys, which didn't have anywhere near that level of fatty buildup on the walls of the arteries and so on. And the only difference between the monkeys was the stress. So it's like you look at these people who focus so much, some obsess over what they eat and the amount of exercise and, don't have this and don't have that. And they totally forget being stressed out all the time may be the worst health factor in your life. It must be addressed.
Megyn, I think you've hit the nail on the head, and that's the elephant in the room. I think everything that underpins what's really driving at the root of the problem is the chronic stress, and it comes down to how we live, how we interact with each other as well. We know that one of the biggest predictors, I know you're talking to Brian Johnson later, but one of the predictors of longevity and happiness, actually the quality of our relationships, having someone to love and someone that loves you. That it sounds very basic, but it's so important. And that mitigates also from the external stresses of life, which are inevitable. So all these conversations need to be had. And of course, it also applies to, a child being nurtured by their mother. I think I always tell people the most important relationship you're going to have in your life, I think, is the one between mother and child. How you're brought up and being allowed to create the conditions so that moms can be there for their children so they can have a nurturing upbringing rather than being a single mom, for example, working 2 jobs, trying to make 2 ends meet in an unjust system where they're not getting paid enough, where big corporations exploit their workers, where you've got a pay differential between the CEO of a company and the production worker of 326 times, which I think is a figure now, which is extraordinary. So we have to have a conversation as a society saying, is this actually fair and just? And then you add in, Megyn, on top of that, I'm all for meritocracy when people are earning their money doing the right thing. But a lot of these big corporations have made their money through mass deception, right? You look at Big Pharma, for example, and then they don't pay their taxes. And then the government have less money to spend on public services, which are being degraded and undermined.
So we have to link it all together. The CEO of Pfizer made, I think, $30 million last year. That was his take-home pay, which I think is one of the reasons why. Just Pfizer in general and these vaccine companies, we're all very skeptical of them now. Not all, but many of us are very skeptical because we don't feel like we've been given the truth. There was an extraordinary moment where he showed up at the Trump White House on Black History Month on the celebration. And Trump, who, he is still pro-vaccine, and he introduced him like, yay, CEO of Pfizer. And the community wasn't having it. Somebody on Twitter pointed out, or X, Trump led a populist movement, but he doesn't control the populace. They still have their own feelings on certain issues, and Pfizer and the vaccines are one of them. Look at this.
We also have the head of Pfizer here, so I want to thank him. One of the great people, one of the great businessmen. Thank you, Albert. Thank you. Thank you very much. Thank you very much.
Trump gets it. He knew. But his most loyal followers were not having it. We continue to face uncertainty when it comes to the economy, with a perfect storm brewing as Social Security and Medicare hit a breaking point as the largest generation is hitting retirement. A smaller workforce means a smaller tax base. You pair that with our growing national debt and rising cost of living, and we could have a big problem. So what are you doing now to protect your family for the future? Well, gold can be a safe haven in hard economic times, and Birch Gold makes it easy to diversify a portion of your savings into physical gold. Birch Gold will help you transition an existing IRA or 401k into an IRA in gold, and it does not cost you 1 cent out of pocket. Protect your future today. Text MK to 989898 and get your free info kit on gold and a copy of the Ultimate Guide for Gold in the Trump Era with a foreword by Donald Trump Jr. There's no obligation, just information. Birch Gold has earned the trust of countless Americans looking to safeguard their savings. Just text my initials MK to the number 989898 today. Thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.